tips. Very interesting.
Hope all you are fine. Today we will focus into the chin and jawline injections. It will not be a long presentation, but I will try to tell you some tips and some tricks. So it will not be too long presentation, but very focused. You know all Algeness. Why I prefer Algeness in some areas like temple, like zygoma, like nose, like chin and jawline, because it's hydrocolloid, no swelling, because it has really good and maybe the best high G prime. And it gives a very good structural support to the tissues, so no migration. So I prefer in these areas Algeness. And here in jawline and chin, what is the advantage of Algeness? It has extremely low migration, no swelling because it's not hydrophilic, and it gives excellent shaping, contouring, and it has high G and gives very good definition and projection in chin and definition in jawline. So I prefer this filler in these areas. This is one of my patients. I'm joking, but everybody knows this patient. So after these photographs in the media, everybody interested with chin augmentation, chin projection, and the jawline definition. Let's start from chin. You know, there is some bone resorption by aging, but also constitutional or congenitally, you may need some augmentation and replacing some loss in bones. And in plastic surgery, we usually used to use fascial implants in these kind of operations, in these kind of patients. But for a few years, I stopped using implants. I just use Algeness filler because in order to me, I believe that it's much more better than implants and no risk as implants. What are the risks in implants? You can see here, if you use silicone implants, you can see some bone resorption after years. You can see some deformity after silicone implants, or sometimes in like Medpor implants, you can see dislocations here. And it's also a surgery, not like filler. It's a surgery, but filler, it's no downtime and very easy to do it. No dislocation. If you do it well, you can repeat it, you can correct it. If you don't like it, it's not permanent. It degrades totally. So Algeness, in order to me, is much more better to give a shape for chin and jawline, and much more cheaper and the easy way. For measurements, for chin augmentation of analysis, it's a little bit complicated, but we don't need to do that. This is nasion and this is stamion here. This is a line between them, and you see the gap here with the pogonion and here, and we call this Legans angle. This is the angle of Legans. So if you are posterior to this line, it's prognathy, and if it is forward, it's retrognathy. But it's not complicated. Just think that the perpendicular line from nasion, and this is the pogonion, and this is the ideal case. But look at here. This is a retrognatic patient, and this is the angle. And you see the gap here. So we do injection Algeness, and this is immediate after. Only Algeness injection to the chin. And this is 6 months later. There is some resorption, yes, but there is still filler here. You can see the gap here, and 6 months here. Maybe it will last 1.5 years, 1.5 years to total resorption. So if you add some small volume here, you can maintain the initial projection. Degradation time, you have to know that it's a linear degradation for Algeness. So if you inject 1.4 ml, it degrades in 15 months, 16 months totally. But 8 months or 7 months later, it will become the half of the initial the product and the projection. So the realistic expectation is very important. For example, this is a chin implant. We use these kind of implants too much. This is a normal chin implant, not a big one. And look at the dimensions. This is 3.8 centimeter. This is 1.8 centimeter for only 4 millimeter projection. Here you need 2.8 ml filler only for 4 millimeter injection projection. So the expectation should be realistic. 1 ml means 1 ml, not more or not less. Okay, so you need an agreed plan for all kind of patients. You have to warn your patient, this is one shrink, you may need more to achieve what you desire, the result, and you need to take photographs. It's very important. The photographs are very important, and you need to obtain signed patient consent. And working in very strict asepsis conditions is very, very important, because we do massage and molding with our fingers. So it is better to use sterile gloves and gauzes. And it is really, really important to work in asepsis conditions. Okay, and before chin injection, if there is hyperdynamic mental muscle, we call it dimple chin, you may need botulinum toxin before injections. You see here some depression here and very dynamic muscles here. So you may need botulinum toxin injection 10 days before. Not do it at the same time. Not do the botulinum toxin injection and the filler injection at the same time. Because it can the botulinum toxin can spread laterally, and it may create a very bad asymmetries. So do your botulinum toxin just in the midline, and wait 10 days. 10 days later, do your injection. And in chin injection protocol, we generally do supraperiosteal injection, and then we do injection into the mental muscle, mentalis muscle. We do small boluses on the bone and the muscle, inside the muscle. We use generally 3.5 concentration, but if you want, you can use 2.5, but I generally use 3.5. You can use needle, 27 gauge, or you can use 25 G cannula. And if we are deep, we stay in the midline. If we go laterally, we have to take care about the submental artery and mental artery. So we do supraperiosteal injections here, and we do subdermal, deep subdermal injections here. Okay, we can see the anatomy here. You can see this is the mentalis muscle, and we do injection supraperiosteally, then we do injection into the muscle or under the muscle. Here, the injection technique in the chin. We can do it with needle, perpendicular injection, touch the bone, inject small boluses on the bone supraperiosteally, and then inject into the muscle. And the second way, with cannula or 27 gauge needle, you enter from the laterally way and go into the medially, bilaterally. So there is 2 injection method, but both is okay. And this is the lateral view. First injection on the supraperiosteally, small boluses, and then into the muscle or under the muscle, small boluses here. But don't forget, in some patients here in submental crease, very dense attachment to the bone with this line. And if you do your injection very low aspect here, lower aspect, there may be some droopy and sagging in chin skin. So you have to be careful to inject it in this front area in this kind of patients. And you can give pressure from the lower part of the chin with your finger. Okay, this is a result with 3.5 concentration. We inject here and laterally in supraperiosteally, 1 syringe here, subdermally 1 syringe here, and subdermally 1 syringe here. Okay, and this is oblique view, and this is the projection. You see the projection. We did injection only the chin and the prejolar area, not go back. But you can see the projection. If you inject here, as I said to you before, it will not good injection technique for this kind of patients. You need to inject in the forward direction. Okay, and this is a patient, and it's congenitally. She needs some augmentation in chin and mandible, and she needs too many fillers. And we augment the chin and the jawline and the mandibular region with injections. Here, sometimes the patient wants pointy chin, and for jawline and pointy chins, this is an injection. First, you inject supraperiosteally, and then you inject mentalis muscle into the mesialis muscle, small boluses, and the pyramidal technique to give this shape, and then you inject subdermally with cannula jawline. I will tell you how to inject this part, but it is mainly supraperiosteally here, subdermally here. Here with needle, and the other part in jawline with cannula. And sometimes, okay, we need, the patient wants to have a good definition in jawline and chin, but they are not a good candidate, because if there is too many fat here, and we cannot do our injections without liposuction. And so we did liposuction first, and then do chin injection and jawline filler. So you need sometimes some combinations. And this is one of the patient. We are doing the chin injection, just aspirate, touch the bone, aspirate, and then start injection. Always we do aspirate, and with fingers, just give pressure from up and down, not to migrate the downside or upwards. And so first you inject in the supraperiosteal way, then you may inject deep subdermally way to augment this part. So we inject in this patient the nose, the radix of the nose, some small injection in this part. It's always good to draw the outlines of the injection area. This is the nose injection and the chin injection and the zygoma injection. And this is, you see the V-shaped and then the pointy chin and a good projection in chin. And this is after nose. You can see in radix injection and chin injection, small injection to the zygoma. And this is 6 months later. you see she has still good projection here, and it helps. Also, this injection and this injection helps the mandibular line. And marionette, let's talk about this part. This is very difficult to treat, and don't do too much filler to correct this deformity. If you need too much filler, then you assess the patient wrong way. There may be some too much sagging face, too much a loss of elasticity. So you have to evaluate the patient very, very good for these kind of injections. Don't inject too much filler. If you inject too much filler, then you may not correct the deformity. In marionette line, if you need, sometimes there is too much contraction because there is a bend here, and this ligament just very strict sometimes and very contracted with muscles. Sometimes we need to inject botulinum toxin to depressor anguli oris muscles here, 1 centimeter out and 1 centimeter lower. We do 5 units or 3 units botulinum toxin before marionette injections. It is very helpful sometimes. And then we can inject in the marionette line. Generally, we use 2.5 or 1.5, 2.5 in the lower part, 1.5 in the upper part. We use 30 gauge needle for 1.5 and 27 gauge cannula we may use. Here is prejawal area. Let's talk all of them. In this kind of patient, in prejawal area, you inject with your needle, perpendicular injection, supraperiosteally, 2.5 or sometimes 3.5, small boluses. The first injection should be here with supraperiosteally, small boluses. And then when you finish it, you can introduce your cannula from here with deep subdermal injection, and here for marionette, again, subdermal injection. Here, the corner of the oral commissure and in the marionette line, this part is a very critical part to correct the deformity. Here, you need to inject just beneath the dermis. You can be superficial here. You can use 1.5 with 30 gauge needle or cannula. You have to be superficial in this yellow area, but here you can use supraperiosteal and deep subcutaneous injections. Here, superficial injection. The other part is deep injections, deep subdermal injections, and here supraperiosteal injection. This is a case. Here we inject supraperiosteally small boluses with 2.5, and with cannula we fill this gap with cannula deep subdermal injection. And then this is 2 years later. There is still our fillers here. She wants some botulinum toxin with here. We did it for parotis gland and masseter muscle. And 2 years later, she has really nice still filler there, no resorption of filler there. And jawline. Let's talk about jawline. In jawline, the mandibular angle here is really important to maintain a good mandibular margin and then good contouring. This mandibular angle is really important. There is 2 directions. One is widening the mandibular angle like this, widening. The second one is lengthening. You see, this is the original border, but we are vertical lengthening with this kind of implants. So this is for widening, this is for lengthening. Here you can see this is for widening and this is for lengthening. For men, widening gives more masculine appearance. So widening is important for men patients, but vertical lengthening is more important in women patients. Here, this is our anatomy. This is the line, mandibular borders. Just divide with the angle of the mandibula and the sulcus here from prejaw sulcus, and this is the midline. This is jaw area. There is sometimes sagging here, so this is jaw area, and this is the masseteric area, the posterior of this part, and this is the chin area, mental area, and this is where is our vascularate. Okay, you see, this is facial vein, this is facial artery, and this is the branch of mandibular branch of facial nerve. So if you go too deep here, you can injure and inject into the vascularate. We never go deep here. We always do injections here subdermally, and here in the mandibular angle we can do supraperiosteally. So we do injections with cannula subdermally for jawline. Only in mandibular angle we can do supraperiosteal injections. There are some poor candidates. Who are poor candidates? That if they have thick skin, you cannot give good contouring and definition. If they have a weak mandible and chin, they are not very good candidates. If they have significant skin laxity and sagging, if they have excessive subcutaneous and submental fat, they are not good candidates. And before filler, you need to evaluate the muscles and the glands. If there is any hypertrophy in the glands, submandibular or paroid glands, you can do your injection 5 units or 3 units each injection points with these glands 2 weeks before jawline injection. Or for platysma muscles, you can do your injections. They call this Nefertiti injections, Nefertiti botulinum injections. Or if there is muscle hypertrophy, masseter muscle hypertrophy, you can inject to the masseter muscle your botulinum toxin 2 weeks or 10 days ago before the filler injection. But you have to be very careful here. Don't go medially, because this is the risorius muscle, and if you close to this muscle, it can affect it can lead a very bad asymmetry in the corner of the mouth. So you have to be careful with masseter injections. In jawline injections, in the mandibular angle, we inject supraperiosteally. We use 3.5 Algeness. We use boluses, small boluses, and we use needle 20 gauge G needle. First, we contact the bone and then aspirate and then do small boluses. We need to contact the bone because we have to avoid embolizing the external carotid artery and vascular structures, because they are just beneath the angle, the bone. They are in the retromandibular plane. And the jawline, we can use 2.5 or 3.5 concentration. We use cannula, 25 gauge cannula, generally 50 millimeter. We use linear retrograde injection technique. And the entry point, sometimes I use the entry point in mandibular angle, but you can enter from where else you want. We have to stay subdermal. not go deeply. And after injection, it is very important to do massage and molding, because we are in subdermal plane. We don't want lumps. So you need to disperse the product very, very well, and massage and molding after injection. And this is subdermal injection plane, you see. But for the corner and the angle of the mandibula, you can use small boluses in the corner. Just touch the bone. It is under the muscle, masseter muscle. Touch the bone, aspirate, and give small boluses in the corner. And also you can use in prejowl area supraperiosteal injection. Nowhere else here. Only here and here. Nowhere else supraperiosteal and deep injections. This, between these two lines, this is jowl area. And in elderly patients, there is some sagging here, and we don't inject filler in this jowl area. You have to be careful with that area. Okay, and this is a patient, and this is introduce your cannula from here to downwards and upwards to subdermal, deep subdermal injections, and you see, you feel all this line. There is no sagging jowl area here, so you can use subdermal injections. So all this area, and this is very interesting case. Why? Because this is immediately after. When you do chin injection and when you do jawline injection, you think that we did submandibular liposuction and neck liposuction. No, this is why people like jawline and chin injections, because it camouflages the fatty tissues in the submental area and the submandibular area and the neck area. So you can give very good contouring with mental injections. It pulls also the muscles in forwardly, and then introduce your cannula from here. Just inject to the supraperiosteally, and then with cannula you may inject your filler subdermally. I generally use 3.5 Algeness and dilute it 0.2 ml lidocaine. I always dilute it with lidocaine. It's more safe for me, and for post-procedure analgesia is really nice. And this is a small nose injection and chin injection and jawline injection. If patients wants, you can lower this part, but in the first session, it's better to do only jawline and chin augmentation. Then, if she wants, you can increase the length, the vertical length, like here and here injection. Okay, and this is a reconstruction patient. We don't do only jawline injections. We also do the reconstructions. Here there is a bone defect after a teeth root infection and fistulization. They just do surgery here, and too much scar, too much fibrotic tissues. So in these kind of patients, if there is a surgery, if there is a scar, you need to dissect first without injection with cannula. Now we are dissecting the fibrotic tissues and create a space for us to inject our filler. Otherwise, the filler can migrate unwanted areas. So first we inject 3.5 in supraperiosteally, and then this is 2.5. We inject deep subdermally with dissection and subcision with cannula. And this is the after injection, and this is from frontal view. You can also construct this kind of bone deformity. You see there is not too much swelling, very good contouring, and very good definition. So what I like in Algeness, you can give this definition. It's like an implant here, not swelling, not ödematous reaction only, and very precise because it's hydrocolloid. If you inject 1 ml, it's 1 ml. You can inject very precise amounts with this filler. Okay, this is a harmony. You can inject mid-face. You can inject and augment the lower face. So this is a harmony. You have to evaluate your patient well, and you will do what you want. And this is a lower face injections with fanning technique subdermally in the lower face, not only jawline, but lower cheek also. So this is a harmony. You need to do a very good assessment of the patient, what she needs. Okay. For procedure in case of complaint, please fill the complaint form and send us the clinical support at algeness.com. And please don't hesitate to call us for whenever you need. This is the training website of Algeness, training.algeness.com. And you can download an Algeness photo application. It's free for doctors. And please don't hesitate to contact with me. Also, this is my WhatsApp number and my personal mail. Please don't hesitate to contact with me if there is any problem or if you have any questions. Thank you very much.
Omar, thank you very much for this beautiful presentation. It was short and very concise and very precise. And thank you very much for this. For you all, do you have any questions? I see that Dr. Raufayan is asking for a question. Then you can, Doctor, you can ask your question by on the chat room. If not, let me try to open your mic, but okay. I can't activate the, okay. Dr. Raufian, do you have any question? Your mic is open now.
No, thank you so much.
Hello, I can't hear you very well.
Remove this filler. How we can remove this filler?
Hello? No question? Okay. Okay, looks like there is not many questions. Seems that the presentation was pretty clear, Omar.
Yeah.
Is there any comment? If you have to ask question, that's the moment. If you have to share experience, it's also the moment. Please do not hesitate. Okay, I have a question, Omar.
Okay.
How can we remove this filler? It's from Dr. Raufian.
Okay. Honestly, in my practice, I never need to remove this filler. It's not like HA. It's very precise because 1 ml is 1 ml. It's not hydrophilic, so I never do overcorrection because I see the results immediately after injection, so I don't need to remove the filler. But if they mean that, when they want to remove the lump or any complication, it's different. But if you just inject, if you think that you inject too much filler, in a few days the patient comes to you and she wants removal of some filler, you can do saline injection and disperse it immediately. And it's really easy to inject warm saline and do massage and disperse the product. You cannot degrade, but you can disperse the product. So in the early stage, if you think that, or if patient wants to remove some filler, you can disperse it. I have never experienced that kind of dispersing or removal, but if you need, you can do it in the early stage. And if it is not in the early stage, if it is a late stage, you can inject to disperse the fibrotic tissue around it, and if there is a small capsula, you can use triamcinolone acetonate injection, diluted triamcinolone acetonate injection with warm saline, and then do massage and advise patient, recommend for doing it at home 5 or 6 times a day. That's all. If there is a lump, it is occasionally the approach may be different because it varies individual to individual. If it is visible, or if it is too deep, or if it is there is infection. So I have to know what is the situation, because in each situation we have different solutions in all kind of fillers, fat, HA, Algeness. If it is invisible, but you can feel some small lumps, don't touch it. This is 100% biodegradable filler. It will degrade by time. If it is invisible, don't touch it. If it is a visible lump, you can, if it is early stage, you can just inject into the mass a warm saline and then do very good massage and pinch it and massage, and you can disperse it. If it is late stage, you can inject with warm saline diluted with triamcinolone acetonate, sometimes 5-fluorouracil, and just inject it and disperse it by massage.
Okay, I think that Dr. Roufian, and then this question has been asked many times about is the product, can we dissolve the product? And I'm always very surprised by this question. I understand that the concern that doctors might have in case of vascular occlusion. This I understand very well. But to dissolve a product after injection, when you inject it to achieve a result, this I have had time to understand why a doctor would want to dissolve a product that's just injected to correct some deformity, or to increase the zygomatic or the jawline or the chin. Then if your question is, are we safe if we eat a vessel, then it's a different question. Because I don't think that you are intending, can we dissolve the product after injection in one area where it's safe? Because with HA, you have plenty areas where you have lumps, granulomas, biofilms, and you not necessarily want to dissolve it. Or if you dissolve it, it's also kind of expensive for the patient. For us, what's most important is the safety profile of Algeness. And if the question is it safe in case of vascular compromission, then this is a different question, and Dr. Buhsema can answer you with the study he did on rats about vascular compromission. Maybe Omar, you can say a few words on this, and then after I have another question for you.
Yeah, we did a study in Izmir University on rats. We just elevate a flap and we inject into the arterial plane the Algeness, and then it was 4 groups. One, we use only saline. The second group we use vitamin C. The third group we use urokinase, antithrombotic agent, and the fourth group urokinase plus vitamin C, to see what will happen. Even if we don't do anything, only with saline, the survival rate of the flap was unbelievable. It was more than 90%. And if we use only urokinase, the survival rate was nearly total. What does it mean? When you inject into the artery, you need to start antithrombotic agent. That might be enough, because when you inject Algeness into the vessel, we saw that there is still circulation, because this is very, very small particles, and 97 or 98% is water, and very small particles, agarose particles inside, and they are not more than 5 micron. So between these, the circulation is go on. So you cannot obstruct as HA, the vessel, totally obstruct. So you cannot totally obstruct the vessel with this filler. But we don't know what happened at the end of the artery. So in all cases, we try to be careful not to inject into the artery, but we know that only using by antithrombotic agent like aspirin, we can treat the situation. Nothing happens.
Thank you, Omar. Yes, you have to understand that Algeness is not a gel like HA. It's a fragmented gel, small particles between 50 to 80 microns maximum. They're very, very small. And that's why it disperses when it's in contact with liquids. And that's why the result of the Omar study on animals in contact with blood, plus the blood pressure, the blood still goes through the artery or the veins, and there is no total obstruction. Thank you. I have another question now. It's a bit technical, Omar. It's from Dr. Tina. What should we do when client has micrognata but projected mandible bone? I don't know what is micrognata. Micrognatia.
Yeah. If it is too much prognatic, it is too much projection.
Oh, okay.
If there is too much projection in chin, you cannot do anything with Algeness. Maybe you can do widening. You can do laterally and widen the chin, but you cannot do retrognative with this filler. As in nose, you cannot reduce the size of the nose. You can only augment with fillers. So if there is too much projection, you can do some injection laterally for widening, but you cannot do retrognative with this filler. You can just try to hide this too much projection. You can just try to hide it.
Okay. I have another question. That's a question, I don't know, it's from NA, I don't know, that I don't have name on the initials. For the doctors who is using stillage, what is the advantage to switch to Algeness? And what is the main difference in the technique?
Okay. I think stillage is a HA filler.
Yes.
The question is, what is the difference between HA filler and agarose gel? Agarose gel unique, that's why we call the brand name. But HA, there is 600, maybe more companies, but all are HA. What is the difference between HA and agarose gel? HA is hydrophilic. It recalls water from around tissues. Agarose gel is hydrocolloid, no swelling. It's material, no swelling, no edema. And all HA fillers, cross-linking HA fillers, includes BDD inside. So even 3 years later, you may see some granuloma because of these chemicals inside. And this is the biggest problem in HA fillers, the granuloma, even 3 years later. And the second problem with HA filler is the giving projection and contouring. You know, the Algeness filler, you can give really, really good projection because it is the biggest high G prime and no swelling, so you can give very good definition. If there is swelling product like HA, you cannot give this contouring very well. Okay, HA filler is not bad. For example, in lips, you want swelling, so lips, you can prefer HA filler. But for example, with chin projection, with zygoma, with mandibular area or in temple, the projection and contouring and giving shape is really, really important. So that's why I prefer Algeness. One is safety profile, no protein inside, no chemical inside. The second one, it has a reticular shape, no migration, and gives very good contouring, shaping, and definition.
Thank you. I have another question from Tina, Dr. Tina, that wanted to have more information about cheek augmentation and temporal technique. And then, Dr. Tina, we had a focus training last week about this. What I suggest you is to be in touch with your distributor. We have recorded this training, and you might have access to this training and have all information from Dr. Buhsema about zygomatic, malaria, and temple injection, because we can't do it now. It would be too long. One more question from Dr. Sarah. Did you have any reaction? Did you have any reaction whenever you injected hyaluronic acid after this filler?
Okay, there is no way, there is no reaction. It's impossible to have a reaction with these two filler, because inside Algeness there is also small HA, but non-cross-linking HA. If there is any reaction, it means that the reaction is about not material of Algeness. Maybe previous fillers, previous threads, or something else. But the safest filler to be injected on another filler or implant is Algeness. Why? Because there is no chemical inside, there is no protein inside, and it's not hydrophilic. So it's really difficult to have a problem because of agarose gel. But there may be a problem due to previous fillers, previous biofilms, previous granulomas, reactivated situations, but not with agarose gel. Again, if you do HA, when you can do agarose gel at the same place, same area, you can do it 2 weeks later. Or if you do it, if you do agarose gel, when you can do HA at the same plane, you can do it 2 weeks later. But at the same time, if you inject agarose gel to the supraperiosteally, like in zygoma, but if you want to do some hydrophilic effect, mesotherapy, intradermal injections with hydrating the skin. You can do it at the same time because they are not at the same plane.
Okay, thank you, Omar. Any more questions? Yes, I have one more question. Is there any difference in the injection technique compared to HA injection?
Okay, like in HA, there is two injection techniques. One is with needle, and one is cannula, and one is bolus, and one is linear retrotracing technique. There is not too much injection technique. In agarose gel, we say that this is a reticular structure. This has a reticular structure and no migration. This is very good advantage for us because when you inject here, you give very good definition, no migration, no displacement. So this is very good advantage, but you have to be careful. If you inject it in soft tissue, you need to inject and you need to disperse the product inside the soft tissue. So our main injection technique is linear retrotracing technique. But on periosteum, you may inject small boluses and do massage and disperse the product, no problem. But the main injection technique in soft tissues is linear retrotracing technique and disperse the product by massage and this technique. Just to prevent from lumps. The only complication you can have with this filler is wrong injection technique and have some lumps. That's all. Because material, you cannot have any complication, no granuloma, no reaction. But if you don't work in sepsis conditions, in asepsis conditions, you may if there is contamination. Of course, there may be some infection. If you inject bolusly in the soft tissue, you can see some lumps. Like in calcium hydroxyapatite, it's the same. If you inject bolusly, you can see lump.
Yeah, basically there is no difference in technique. There is. We recommend always the linear retrotracing technique and deep injection because all the explanation that Dr. Buhsema just gave regarding the structure of the product. In some areas, you can use boluses, and this is well explained in all trainings. Areas such as canine fossa, temple, and sometimes in chin, as explained today. But there is no difference in injection technique itself. It just be deep and proceed to a good massage and good tissue integration of the product. Integration of the product into the tissue is important. This will guarantee a very smooth result, and patients love it because they don't feel the product. And this is a very big advantage of Algeness due to its structure. We have one more question, Omar. Is there any contraindication with Algeness?
Okay, contraindication is the same with HA or other fillers or other treatments. What is the contraindication? For example, if there is a pregnancy, you cannot do any kind of injections. Normally, it is not harmful, but if there is any problem, the patients can blame you and claim that this is the reason. But we know that it's not the reason. But we never recommend to use in pregnancy. In bleeding disorders, you have to be careful in bleeding disorders because there may be some hematoma. This kind of restrictions we have, but normally with this material you can use everywhere in the body. You can inject everywhere in the body. Just you have to be subdermal. I cannot tell it here with officially, but we use this filler on hand, on perianal area for reconstructions also. This is totally natural product. You can inject everywhere, no contraindication. And theoretically, if there is any allergy, known allergy to agarose, okay, this is contraindication, but we don't know any kind of patient like this. Never seen and never heard.
Yeah, don't forget that agarose is just a polysaccharide, pure sugar. In Algeness is polysaccharide and saline. Then there is basically no reaction to Algeness and to agarose. And the body knows this kind of product, polysaccharide.
Yes, sometimes. Yeah, it's sometimes maybe there is an autoimmune disease, and any kind of injection with HA, with this kind of product or implants, it may aggravate the situation. It's okay, but it's not about the material. It's about any kind of injections. For agarose gel, it's really safe. No protein inside, no chemicals inside. So no, it's sugar, as you said, so we can inject in all kind of patients. But the other disease, if the other disease don't let to inject anything else, so we don't do it.
Okay, thank you, Omar. Is there any other question? Please don't hesitate. And then there is no. All questions are good. There is no stupid question. Then please, just if you have any doubt, if you have any concern, don't hesitate. That's the right moment now to ask all your questions. No, looks like there is not questions anymore. Omar, thank you very much for this presentation. It was again very, very nice, very clear. Very informational. Thank you to all of you, to all the participants. Thank you for staying with us today, for attending this training. We will have other trainings coming. We will redo our basic and then our focus trainings in the coming weeks and coming month. Then if you have any question, do not hesitate to write us. You can ask your distributor and your distributor will come to us, or you can write directly on our website or to Dr. Buhsema directly. It's also possible. Omar, if you want, maybe put the slide with your infos, the slide before this one, on the screen, then everyone can copy your email address. Okay, here it is. Then you can write to clinicalsupport@algeness.com. This will go directly to Dr. Buhsema or his personal email address if you have some personal questions, and or on his WhatsApp. Do not hesitate. It's our role, that's our job to help you. Do not be afraid to inject Algeness. It's the most safe filler on the market right now. You won't be disappointed with this product because what you see when you inject is what you get. You won't have this big swelling or inflammatory reaction that is recurrent that you might have with some other product, or reactions to BDDE or whatever chemicals are into the other fillers. Then it's just very natural, very safe, and so far the complications are very minimal. Usually that's lumps, and we know exactly how to disperse a lump. Then it's very simple. Thank you again. Enjoy your weekend to all of you. Thank you for the people that was already a weekend for them, and I'm thinking to all our Muslim friends that today is a day off, but have been with us today. Thank you for taking the time. Enjoy your weekend, and hope to see you soon. And very important, stay safe. Thank you.
Stay safe. Bye.
Bye-bye.